Good morning, people. This is Nkuli Malo, your training coordinator from BPCBE. And today, I would like to thank you for all joining us today. And most of all, I would also like to welcome Ms. Tebogo Machokucha, the manager of communicable diseases, right, from the Department of Health. Today, we'll be actually speaking about monkeypox awareness in the working environment. And I would also like to welcome her fellow colleagues who have joined us today from the Department of Health. Thank you so much for the support and joining us today at this webinar. I hope this will be informative enough for everyone to be aware of what's going on and to also prepare us when the monkeypox disaster spreads. Thank you, Ms. Tebogo. Would you like to proceed and start with your presentation and let us know what we should do in this disastrous disease? Thank you.
Thank you so much once more. As I'm going to start with my presentation, yes, monkeypox is a public health of a concern now. It has been declared as a public health international concern as of the 23rd of July, which was on Saturday. The reason they are declaring this as a public health of international concern is because they are seeing a rapid increase in the number of cases in most of the countries. So as soon as you see a lot of cases being reported in most of the countries, so this should be declared as a public health of international concern because it also needs some international responses. Monkeypox, just like any other virus, this is a virus. Is this caused by the monkeypox virus? Is a member of the orthopox virus genus, which is a family of the poxviridae. The poxviridae family, it belongs to the same group as the smallpox as well as the chickenpox. This is one of the same family. So as the monkeypox, the name explains itself. Monkey, which means that it comes from the animal. So this is a viral zoonotic disease that originates from the tropical rainforest of the Central and then the West Africa. So this monkeypox is endemic in African countries. So now the pattern has changed a bit. So this at the endemic, when we say endemic, this is where the number of cases are being reported year in and year out. At the particular season, they know that they will see this number of cases in Western Africa. So it's no surprise to them when report these cases. However, as the years evolves, especially in 2022, we are seeing the monkeypox in the areas where we used not to see them. So monkeypox was first identified in 1958. So they took some of the colonies, 2 colonies from the monkey, hence the name is a monkeypox. It's because the disease was identified in monkeys in Denmark. So the human case, when we started seeing the human case, it was in 1970 in a small boy who was aged 9 months of age at Congo. So the natural reservoir for this disease is believed to be rodents. Rodents, in the layman's term, we are talking about the rats, is mostly that you will find this kind of disease, but it's not limited to other non-primates. We are just showing you some of the cases, historical cases that were reported previously. From 1970 to 2018, most of these cases, as you can see, they've been reported in the Western Africa, as you can see, is Congo, Nigeria, Gabon, and Cameroon. Those are the cases that have been reported every year. So other countries were not reporting monkeypox at all. But this year, we have seen change the pattern of these cases. These cases are mushrooming and they're overlapping. In most of the countries are reporting the monkeypox. To date, as of the Saturday on the 23rd, 74 countries reported the cases of monkeypox. 68 of these countries they were not historically reporting the monkeypox, and 6 were reporting. Those are the African, the Congo, Nigeria. Those are the ones that are reporting. And we also see a certain change in the number of reporting. Most of the cases that have been reported, they are from the non-endemic area. We are talking about South Africa as well. This is an emerging disease which was not there previously. So unfortunately, so far, 5 deaths have been reported in African countries. This is how one can get a monkeypox. Because this is a zoonotic disease, it means that we humans get it from animals. And then once they get it from animals, then there can be a human-to-human transmission. In terms of how humans get it from animal, people get infected through consuming the infected meat. Is when you are eating, for instance, when you buy a biltong, which is undercooked, and then you eat it from when it has been infected with monkeypox, you will definitely get the monkeypox. And in our families, we do have people who are owning pets. For instance, people that've got small rabbits. We can see our kids now, they've changed, they've adopted to having pets as we live with them in our families. And then through the bodily fluids, once they lick them or they exchange some saliva, they kiss them. And if that animal is infected, that's how humans get the monkeypox. And in terms of the human-to-human transmission, yes, we said the natural reservoir for this disease is the rodents, which in this case is the rats. We are saying that exposure to human is quite high, and there are several things that when you are exposed to them, you will definitely get the disease. So the exposure occurs through the broken skin, respiratory tract, the mucous membrane, which require the close, prolonged face-to-face contacts through the respiratory droplets. As you can remember with COVID-19, if you're not wearing your mask, you are sharing an office in a closed environment where there's no circulation, you will definitely get this disease. The main basic thing here is the direct physical contact with the infectious body fluids. If someone is having a monkeypox and then you hug them, you kiss them, and during sexual intercourse, that's where you will get the monkeypox, because you are in a physical contact with this particular person. The indirect physical contact, it includes materials such as clothing as well as linens. When people, they exchange clothes, if someone gives you a jacket and someone that person has a monkeypox, and then those lesions, they've cast and then they open, and then those droplets, they fall on the very same cloth that will be changed, you will get the monkeypox. You get visitors from your home, you make them sleep, and then when they leave, you don't change the linen. That's how you will acquire or you will get the monkeypox. This is quite crucial, colleagues, in terms of how you get it. And then the monkeypox is not sexually transmitted, colleagues. There have been some people thinking that monkeypox can only, people who are having sex, men who have sex with men, they are the ones who are getting monkeypox. The gays, to be specific, it's not like that. The spread occurs, yes, during sexual intercourse, because there's a physical contact with the next person. Physical contact, you are kissing, you are hugging during sex, yes, those lesions can burst, and then you can get the disease. It still remains possible that you could get it through the genital residue. However, studies are still being made in order to confirm this. Mothers can transfer the disease to their fetus during pregnancy as well. The disease progression, how does the disease progress in one's body? So we are having an incubation period. Incubation period is when you have the virus in your body, but you don't have any signs and symptoms. In other words, is you are still cooking. You're cooking, this virus is still cooking. You don't have any signs, you don't show any symptoms, you don't feel anything at this stage. This stage, you are not infectious. Then you are having progression, where there's a febrile stage, which occurs depending on one's immune system. It occurs between day 1 and week 1 and week 2. Then you will develop fever, and then you'll have swollen lymph nodes, you'll have headache, you'll have chills, sore throat, malaise, as well as fatigue. These same signs and symptoms, you can also experience it. They share the very same signs and symptoms with other diseases. So when you are at this stage, before you develop the rash, this is after you got the fever. You develop the fever first, then you get the rash after 2 to 4 weeks. Hence, we are saying that people with monkeypox should isolate or stay away for 21 weeks, because in between that weeks, after 21 weeks, the sources, they should dry off, and then they'll start to fall off. And then that's when you are no longer infectious, as you can see. This is where you will get your sources. Some people, they do get a source on the face. Some, they do get their source in on their hands, and then on their private part, such as the penis, the vagina, as well the anus, is where you will get most of those sources. So for you to identify this kind of sources, the lesions are well circumscribed, deep-seated. So you will see them that on top of your sore, there's a dot on top of your lesions. That's how you identify this. So you develop fever, and then you have rash. You need to seek medical attention immediately. So you see some of the lesion in your palms, you see them on your soles, and then you will basically, you can see them anywhere part of your body. How are we making people aware of monkeypox? By raising awareness, of course. We do have the health promotion team that goes around the workplaces, that goes around in the community, educating people about the monkeypox, what kind of signs and symptoms you should look for, and what preventative measures one should take in order to keep this disease from spreading further. Other things that you should avoid: if you suspect someone who has a rash, unexpected rash, please do not hug, you don't kiss that person, or you don't have any sexual intercourse, even if it's your partner. You should seek medical attention immediately. You don't share any utensils or cups in the office with that particular person. You don't share the bedding or sleep in the same bed as that particular person. Make sure that we wash our linens, especially when we had visitors around. We wash our towels, we don't exchange with our clothing as well. We cannot emphasize it enough. You should wash your hands with soap and water, and use alcohol. Just like you are treating the COVID-19, you should apply the non-pharmaceutical interventions that were put for COVID-19. You should apply them here as well. Treatment: there is no treatment for monkeypox in South Africa. I want to elaborate that. In South Africa, we don't have any treatment for monkeypox. There are treatment for monkeypox in other countries. However, the treatment is very expensive. So the vaccine, when you go to the good part about monkeypox is after 4 weeks, it's a self-limiting disease. So after 4 weeks, you should start to be recovering, and then those lesions, they should start to dry off, and then they will peel, to dry, and then they will fall off. So self-limiting, you isolate for 21 days, and then will give you some medication just to ease the pain. It's not like it's a vaccine for this. People, however, who were born before 1980, they must have some kind of immunity against the monkeypox, because the very same a vaccine that was given for smallpox, it's supposed to give some kind of protection, 85% protection against the monkeypox. We are not saying that when you are born before 1980, it's obvious you won't get the disease. What we are saying is you've got some kind of protection or immunity against the monkeypox. So people who are 42 years and younger, they are at more risk of acquiring this disease. In terms of how this is diagnosed in the laboratory, they are using what we call a polymerase chain reaction, which is called the PCR, is what they are doing also with the COVID-19. It's just to identify the strain that they are finding, whether the very same strain that other countries are reporting is there the same strain that South Africa is reporting as well. So what they do is they will take a swab on the lesions, and then this will be taken to the laboratory to do some further tests. And in our case, our reference laboratory at the moment is the NICD. I just want to take you colleagues through the cases that were confirmed in South Africa. This was between June to 13th of July. We had the first case in Gauteng. This was a male, age 30 years. And then he presented with vesicular penile rash, fever, swollen lymph nodes, as well as general flu-like illnesses. That's how they picked them. So this guy was having 5 contacts, has recovered, and there were no secondary cases that have been reported so far. And the other case was reported in Western Cape, same, more or less similar age group, and they were males. So all these cases were males. So like I said prior, this is not the disease for gays. Anyone can acquire this disease, because when they were doing some history, they did identify that they were having sex with other males. So in terms of what we do after we have identified these cases, we do what you call contact tracing, which most of you, I think you know about it and you've heard about it during COVID-19. Contact tracing, we do contact tracing in order to interrupt the chain of transmission. So the more we get people who are infected, then these people, they isolate for 21 days, is the more that we reduce the progression of the disease further. So the aim is to identify, is to trace and monitor contacts of monkeypox cases in order to ensure that the public health measures are instituted to contain the spread of the disease further. We are having what we call the case definition. So immediately when we have the disease or we are having an outbreak, then the committee sit together and we are saying what kind of, how do we define a person as a case? A suspected case, it will be someone with an explained rash. Anyone with an explained rash, we are not gonna point fingers when we see our colleagues with some rash and then we conclude that they have the monkeypox. It's not like that. We do have some differential diagnosis. Someone can have scabies, someone can have a smallpox, someone can just have a normal rash. It doesn't mean that when you see someone with a rash, you conclude that they are having a monkeypox. And the other thing is suspected case, unexplained acute rash, and one of the signs and symptoms, the fever is above 38 degrees, and then we are having headache and then swollen lymph nodes. Those people will then need to seek medical attention immediately. As I've said, we also have a differential diagnosis. Differential diagnosis, those are similar diseases that can share same signs and symptoms. Remember, these groups of diseases, we said that they've got families. These are family of chickenpox. You can mislead it as a measles, as we are having some circulating, or we are having outbreaks of measles at the moment. So someone with an acute rash, it can be one of those diseases. A probable case is a person meeting a suspected, meaning that they've got an acute rash, they've got those signs and symptoms. It's either they've got fever, they've got lymphadenopathy, they also have some of those that I mentioned, and then they have a history, travel history. Remember, these are from the endemic. However, with the cases that we have identified, all of them or two of them, it looks like it's a local transmission because we could not identify the index case. So this is a confirmed case for sure. Then now we are sure that this person has a monkeypox because now all the isolates have been taken to the lab and then they confirmed that indeed they've run their PCR. Sometimes they can do what we call sequencing. Sequencing is when now they tell you, the scientists, that COVID-19 has mutated. We are now having an Omicron. It's because sequencing was done, and then they can even tell you that this is a BA.4. That's what sequencing is. It's just to tell us what kind of clades or what kind of strains are circulating in the country. When initiate contact tracing, as soon as a suspected case is identified, then you give them the case investigation form and then a contact line list. When people are gone for testing, it is very crucial that they enlist the names of the people that were in contact with and being realistic and truthful about that. They should also enter their correct identity, like their demographics, and also their contact details and the addresses, colleagues. This is very, very crucial, as in most cases, when we are trying to trace down the contacts, we waste a lot of time trying to identify. Their phone numbers are incorrect. Sometimes even their physical address that they've given to their doctors, they are incorrect. So instead of us keeping the disease, it becomes impossible for us as well. So people need to be truthful. When you go to visit your, you've got an explained rash, just be realistic and truthful, list all the contacts, people that you have been in contact with, so that contact tracing can start immediately, regardless whether you'll have a negative test or a positive test. We have different ways of monitoring. We've got self-monitoring, which is the passive web contacts provided to signs and symptoms, and we do the self-monitoring, and then is what you are isolated at your home, and then when you each and every day, you are monitoring yourself, whether you've developed any signs and symptoms. If you've developed any signs and symptoms, and the group will be calling you as well. Then you notify the health workers should you see that maybe you have developed some rash, maybe this is what is happening, please let us know so that we can help you immediately. We do what you call telephonic monitoring. Telephonic monitoring, we do call each and every day, depending on the number of cases that we are having in the country at the moment or in the province at that time. Sometimes we do what you call face-to-face, is where we go physically, we come to your house to come and see how you are doing. But this also depends on the human resource as well. So monitoring is done for a period of 1 day, as I've explained that the incubation period is between 1 and 21 days, is where the person is mostly infectious during this period, and the disease, it lasts for 30 days because it's for 4 weeks. So after 4 weeks, you should be healed. It's self-limiting, no medication you'll be given. It's just to ease the pain. Yes, you'll be given the medication to ease the pain, but not necessary that we are treating the monkeypox. This is all we had, colleagues, and I forgot to mention that when you are at workplace, when I said you must avoid, remember the lesions they can develop in the palm of your hands. So your colleagues can touch your laptop, or you are using the same PC, which is very dangerous, because if one has those lesions and then you touch the same computer or any other material, you touch the desk, you touch the kettles that they are using, you are at risk of getting the disease. So the awareness, colleagues, if you suspect you've got unexplained rash, please seek medical attention immediately. Thank you so much. Over to you, Nkuli.
Well, thank you so much, Ms. Machukocha. It was very informative. Thank you. And thank you for coming. I just need to ask the members or anyone, any of the participants, if they have any questions regarding the monkeypox. All right. So, Ms. Machukucha, apologies on the attendance once again. But it was very informative, and now we actually know what to do, the working environment, what to look out for. We've got one question from Tsepiso. Over to you.
Really, thank you for the opportunity. Thank you so much for the presentation. It was very helpful. My question is, like, in terms of the offices, like, is the disinfecting also applying to our regular office management in terms of cleanliness, and also, like, in terms of sharing utensils, like in the office, is it hygiene enough to be using maybe jig when you're washing the cups, or is there anything that we can do so that we can prevent the passing of the virus?
Thank you so much, Sepiso, for that. Like we've alluded before, yes, in terms of protecting yourself in the work environment, sanitizing, you should still continue doing that. You clean your desk with your sanitizer each and every day when you come, or whenever you feel like there's a necessity to do so. You still apply those non-pharmaceutical interventions. And in terms of using a bleach when you are cleaning, this is highly also recommended that you do so. And it's also, again, we are relying on other people. It's just like COVID. We are, in this instance, we are relying on our colleagues, really, that when they do have some kind of signs and symptoms, not necessarily because they know that they've got, if they've got an unexplained rash, we are expecting that people should stay away up until they know exactly what are they suffering from. But in case of sanitizing, continue doing that. You wash your hands often with your soap and water. That's the way, way of protecting yourself. Over.
Hi, thank you so much, Sepiso. Is there anyone else who would like to ask a question? Okay, all right. Thank you so much. This was very informative. Thank you for participating. And once again, apologies on the attendance. But yes, so I would like to say once again thank you, and we'll have to end the webinar since there are no more questions to be asked. And yes, thank you so much, Mr. Bukhoma for coming through, and thank you, members, for also participating. Thank you so much. Thank you to the Department of Health as well for joining. Thank you so much for the support.